Finally, let's just take a look at some radiological images of the spine so that when we see these things come back for our patients, we have some idea as to how to orient ourselves in what we're looking at. So first, let's start simple. Plain radiograph. This is just an x-ray. Usually on an x-ray of the spine, you're going to be looking at some specific segment for evidence of some kind of an injury or pathological condition. The image that you see here is of an infant spine, and let's just orient ourselves here really quick. So on a regular radiograph, and I'm sure you probably already know this, but white, here we go. White equals dense, black equals air, gray is in between. So you don't necessarily think of these things as being, white things on here as being hard necessarily. It just has to be dense, or it can be a lot of things stacked up on top of each other. Remember, these beams are going straight through whatever whatever it is that it's aimed at. So the more stuff it has to go through, the more likely that's going to be bounced back and registered as white. So in this case, we're looking at the spine. Here we have the posterior aspect. There's the back. Here's the back of the neck and all cute baby chunky neck rolls. We have, what do we see in here? Those are cervical spinous vertebrae. So we have the bodies of those vertebrae here, here, here. And you can see transverse and spinous aspects of those. Now what do we have further down? Like right in here, let's say. Okay, we have our bodies of our vertebrae here. For example, these ones are quite clear, so I'll just pick on those. What else do we see going through there though? We can see the spinous processes sticking out. Can we see transverse processes? This is a lateral view. At most, you're going to see transverse processes as being like a circle that's a little bit wider than anything else surrounding it because it's pointing straight at the camera, right? So it's going to just look like that. In the case of the thoracic spine, what do we have coming off of the spine that's also forming a joint, partly with the transverse processes? We have the ribs, right? So these are going to kind of merge visually up against each other. Here, you kind of have where all of those things are converging, and we have individual ribs going out over there. Okay? And finally, down in the lumbar spine, you can see bodies of those vertebrae. I'm not tracing these very well, but here we are. And look how much space, just to point out here, you have between each of those vertebrae compared to like over here or up in here. Here's one vertebrae and here's the other vertebrae. Remember, the bigger bodies of the vertebrae, the more space and cushioning you need between them to keep everything safe. And this is also at a point of flexion too, so it just looks like there's a good bit of space. We have our our spinous processes jutting out back here. Actually, it's 1, 2, 3, 4, 5, just those ones. And you can see pedicle and lamina as part of those arches. I'm going to erase a bunch here, just since now you're sort of oriented, and I want to look at structures that are maybe a little deeper. Whoops, that's not the eraser yet. There we go. Okay, delete, delete, delete. All right, so what else can we see here? Can we see the spinal cord? No, you cannot see the spinal cord in this type of an image. Can you see where it would be? Yes. So if we have spinous, I'll just pick on the lumbar spine here, just sort of because it's sort of easy. We have spinous processes here. Okay. We've got transverse processes somewhere around there. We have part of the arch. We have bodies. Where do we have the vertebral canal? Right, we have it right through here. So if we had some sort of a problem that we could identify where you have a jutting into this area, from this angle, you can only tell what direction it's going in so many ways. If it's coming straight out at you, it's going to look the same as if it's going straight back away from you. And if it's pointing from the body of the vertebrae and into the vertebral canal, let's say it's just straight on back, into that space, you can't tell if it's pointing a little bit away or a little bit closer. You can just say, well, this might be impinging on the spine if you don't see evidence of any other kind of trauma. Just generally speaking, what else can we see here? We can see occipital bone, part of the skull. We can see a little bit of mandible. We can see, where are we? We can see some ilium, some pelvis in there, right? What's all this stuff? This like balloony looking stuff. And why is it black? In here is intestines. So this stuff here is actual tissue. That's tissue. But it's gray. It's not nearly as bright as the white of the bones. So it's less dense, but it's still something there. So it's going to be like an in-between kind of a color. And then all of these there that you see are air pockets. Those are gas pockets. You can see some open space too in the lungs. If you were to do an AP view from the front of the body, like looking straight at the person on their front, you would see those lungs very big and open and clear and black. Since we're going on a side view, there's more tissue in the way and they don't look necessarily quite as open. You also see a little bit more of the heart impinging on this, and this is exaggerated, but impinging on this space a little bit and making it seem overall a little bit more opaque than you might have otherwise anticipated. Okay, so now we have an example x-ray. This is of somebody's cervical spine. Take a minute and identify, to the best of your ability, if this is an anterior posterior, an AP view, or if this is a lateral view. Identify where bodies of the vertebrae are. Identify spinous processes. I'd like for you to find C7, atlas and axis, and tell me where your intervertebral discs are. So pause this, find those, and then come back and I'll tell you. Okay, so I'm going to pick different colors for these like I have in the past. So this is a lateral view. Oops, my L didn't show up. And you can tell, because like here's their mandible, here's the back of their head, here's the back of their neck, as evidenced by the spinous processes, there's their chest. Where are the bodies of the vertebrae? Why, those are the stacked up rectangles right there. Right through there. Can you tell which one is C7? Even if you couldn't pick out all the bodies of the vertebrae, which through here it's a little tricky because you have a bunch of stuff overlapping, it's going to be a very, very long pointy one, so that's C7. So this is the body of C7, C6, C5, C4, C3, C2, and C1 is up there. Where are the spinous processes? Those are, I'll do those in red. Your spinous processes are these guys. And I'm not highlighting the entire thing, I'm just highlighting sort of the point, like the tippy point of them, so I don't clutter up the image too much. But remember, when you run your fingers up and down along the spine, what you're thinking of is running your fingers up and down the spine. You're running them along the spinous processes. Can you see atlas and axis? You can see atlas and axis, actually. You can see C2, is that atlas or axis? That's axis. And you can see C1 as well. And in fact, you can see the dens just a little bit as it sticks up through there. That would be a very high level thing to be able to pick out though. And now where would your intervertebral discs be? Well, those are going to be between the bodies of the vertebrae, right? So these spaces in here are going to be filled with the intervertebral discs. And remember, in a regular x-ray, in a regular radiograph, we're not really going to be able to see them because they're not actually all that dense. Certainly not as compares to bone. So let's move through this one a little bit more quickly. What view is this? This is going to be an anterior, posterior view. You're looking at them either from the front of their body and then the beam is going through the back, or the other way around. You can't really tell looking at this which way it's going because everything is flattened out onto the plane. So the bodies of the vertebrae, where are they? They're going to be right in here, but they're not nearly as distinct from this angle, right? Because you've got a lot of other stuff going on anteriorly and posteriorly to them. Spinous processes are these circles, and I'm not doing every single one of the vertebrae. I'm trying to keep this a little bit uncluttered. Intervertebral discs would be in between these spaces. Can you see atlas and axis from here? You can. It's tough. But here is axis, right? So here's the dens. So atlas is through here. You can't really see it. Look how high up that is on the head, though. But I mean, it makes sense, right? Because here you have the bottom of the occipital bone. Here's your jaw, right? Here's some ear. So that seems about right, right? So that's C2, and then C3, C4, C5, 6, and C7. Okay, so now moving on, we've got another x-ray. We have both the lateral and the anteroposterior view here represented, right? We have the lateral view on the left and AP on the right. The bodies of the vertebrae are all stacked up here, and you can see them separated. So here's one, here's two, just to pick some that are sort of easily distinguished, right? Spinous processes are jutting towards the back. Ribs, we already saw that in the first slide. Oh, and I'm not doing it on the other side. So we have bodies of the vertebrae here, there, and so forth. We can't really see the spinous processes super clearly on the AP view for a lot of it until you start to get up here above the heart, which is all of this big guy right there. You can see the ribs on both of these views, right? And intervertebral discs, again, are going to be basically clear. What organs can you see here? Well, I already pointed out the heart, which over here is this guy right here. And the lungs are mostly air, right? So they're going to be overwhelmingly black. So all of this black space that you see in here is going to be lungs. Now, I know this is a lecture about the spine, and the lungs aren't exactly part of the spine, but this just gives you some context. Lumbar vertebrae, same sort of thing, right? So we can see the bodies of our vertebrae right there. They're nice and big, right? Very, very big. Can we see the spinous processes? We can see these actually. Oh no, the other view too. I keep forgetting to do this to both views. There we go. The spinous processes are big and broad now, right? And over on the one on the left, on the AP view, you can see the person isn't standing exactly straight because you get a little bit of a profile. So like that are the profiles of those spinous processes. Intervertebral discs are invisible. Sacrum and coccyx. Can we see any of that? We can actually. So here is the outline. Sacrum. Here you can see the sacral crest smack down the middle. You can appreciate where you have some of those foramina. This whole area of overlap is the auricular surface forming the SI joint. Here are your ilia. Okay? Down here is where you have femur inserting into acetabulum. This right here is a full bladder. You can see intestines and gas bubbles through here, right? And even then you can see like the haustra and how there's gas bubbles in individual haustra. There's a big gas bubble here. And then up here is going to be your liver and your foregut, your other foregut organs. Now a CT scan of the spine is going to look very, very similar in a lot of ways to an X-ray. In these images, dense things are very, very bright and less things are black, and grays are somewhere in between. These can be tweaked though. You can usually see a little bit more detail in a CT scan in sort of a three-dimensional sense, and appreciate certain relationships. It's really just a 3D X-ray. If you click on that big nonsense link there, you can see the CT scan for this person and zoom through in three-dimensional space back and forth through this image so that you can appreciate how these structures will look different depending on what plane of section that you can actually get. So what can you see in this image? Just to orient yourself again, we have occipital bone, right? We can see spinous processes, and that's also part of the arch. You can see where transverse processes is sort of a little extra round and dense there. You can see the bodies of the vertebra. You can see the vertebral canal with the spinal cord in it. And interestingly, I like in this one, you can see the hyoid bone actually as well. Instead of using ionizing radiation, an MRI is going to use magnets, and it's going to exploit the polar nature of water molecules to get them to show up or not effectively, okay? These are more expensive and in a lot of ways a lot more detailed than CT scans, but they're also sometimes a little harder to access. And they're not for everyone. They can be very, very claustrophobic. But the detail you can get out of these is pretty cool. So there's three main different ways that you can get an MRI image that's relevant to the spine. You can have a T1 weighted image, a T2 weighted image, and a STIR image. T1 weighted images are very good at highlighting overall anatomy. They show fat as bright and fluids as dark, and bones are going to be somewhere in between. So let me write that down. So for T1, fat is bright, fluid dark, and bone will be somewhere in between. T2 weighted images emphasize usually it ends up emphasizing pathology. So wherever you have fluid buildup, some places. In here, fluid is bright. And so areas of inflammation or edema, or if you have like a meningocele or something like that, you're going to be able to see this better in a T2 weighted image. This is also going to show you better where you have cerebrospinal fluid within your central nervous system. STIR stands for short tau inversion recovery. You do not need to remember that, but what this is effectively a fat suppression technique so that fluid is bright, but fat is still kind of nothing. And so it helps highlight where there is fluid and you can better distinguish it from fat. So this image over to the right, there's the person's face, there's their chest, back of their head, the skin of their back, and fat, right? So what image is this? What weighted image is this? It's a T1. weighted image. And check out all the stuff you can see in here. You can see, because it's really not just about density, everything has some water molecules in it, right? So everything is going to be able to show up to some extent. You can see the bodies of the vertebrae. There's your axis with dens. Here's more. You have your spinous processes showing up very nicely through there. You have some of your neck muscles showing. You have fat. And you can even see how, you remember it in gross anatomy lab, how there is this sort of like pillowy kind of a look. I mean, it's greasy, but like the shape of it is sort of a pillowy shape to fat. You can appreciate that even in this kind of an image. Here you have a little bit of mandible. You can see lips. You can see spinal cord, right? That's going to be super important for a spinal x-ray, right? Even at a most basic level, if you have a herniated disc that's impinging on something, you're going to want to know if it's pushing on the spinal cord or not. So in this type of an image, if you did have some sort of a herniation into the spinal cord area, you would see either like a bulge of that gray into that other gray space, or you would see black where it's starting to, where you have fluid starting to build up in that area. You can see cerebellum, right? And you can see some cerebrum as well. Pretty cool. Okay, so let's take a look at some samples that are not normal anatomy and talk about what we see. So this is an AP view of a patient. So we'll look front to back. What condition do you see? This is very, once you are used to looking at these at least, this is a strikingly off, they've got some strikingly off anatomy here. This is scoliosis, and specifically it's dextroscoliosis. So scoliosis and dextro scoliosis. It's all one word, but this is just so I can fit it without actually impinging on the image itself. What does dextro mean? It means to the right. So if this is the patient's left and this bowing out is to their right side, it's dextroscoliosis. If it were the other way, it would be sinister. Dextro and sinister are right and left. So how do you know? Well, I just described it, because bending to the right. And the spine isn't midline, right? Otherwise, it's quote unquote supposed to be perfectly straight up and down imaging, straight up and down in midline. What type of imaging is this? This is just a regular old X-ray radiograph. There's no three-dimensional element. Dense things are bright white, air is dark. It's very straightforward. You can see spinous processes here. You can see some of the transverse processes, bodies of the vertebrae. Hopefully this is becoming quicker for you to pick out. We've got some ribs. We've got a bunch of intestines. The brighter spots here in the intestines instead of darker spots are going to be fecal matter. We have transverse colon going across there. You'll see all kinds of stuff. Now, what kind of an image is this, first of all? You can see where there's bones, right? So here are your bodies of your vertebrae. They're the easiest things to pick out, right? They're not bright white, so they're not going to be an X-ray and they're not going to be CT. This is going to be some kind of an MRI. Is this T1, T2, or STIR? It's going to be T1. Remember, in that fat is bright, right? In T2, fluids are bright. And in STIR imaging, fluids are still bright, but fat is suppressed. So if you can see any kind of fat, it's going to be T1. Now, what condition do you see here? We have the bodies of our vertebrae there. You can see even your intervertebral discs. In between is those little cylinders. You can see spinal cord coming down that way. Can you see this right here? That bulge? This is a herniated disc. This is specifically a C5, C6 herniation into the vertebral canal. So where you can see, and let me try to just erase that real quick so that you can see the actual image again better. What you can see there, that dark impingement, is fluid starting to accumulate in this area. And the actual profile of the spinal cord becomes substantially more narrow there, right? So that's how you can tell. Okay, moving on, new one. What type of imaging is this? Is it a regular radiograph? It could be, but it looks a little too detailed, and like it in weirdly like a little too digitized. Is it an MRI? Well, no, because you don't see a lot of like fat or fluid showing up brightly. You can see bone instead. So it's going to be some kind of a radiograph. In this case, it'll have to be CT. What condition do you see? So this again is not normal anatomy. What's going on here? Here you have your bodies of your vertebrae. There's one, there's part of the arch, there's your spinous process. Here's another body, here's another body. You can't see the intervertebral discs. And then, oh my God, what is going on there? That is a problem. This is the problem here. What this is L2. And you can even see the spinous process really very nicely has that very blunt shape to it. This person is a construction worker who fell from 20 feet and he shattered the L2 vertebral body. You can even, and let me actually erase that a little bit here so that we can appreciate some stuff around it now that you know where it is, and hopefully it'll stand right out to you. You have this really awful looking L2, and you can even see a little fracture on L3. So let me outline that for you here. That, and then you've got this guy over there. So a little bit of L3 chipped off too. And importantly, you can see that the spinal cord, or at least the vertebral canal, is substantially narrowed through that area, right? So this person fell, was able to get up and sort of like walk it off a little bit miraculously, but they experienced a great deal of numbing in their lower extremities. No paralysis, but a lot of numbing. Why didn't they become paralyzed? In this area, you don't really have spinal cord so much anymore. You have cauda equina. So a bunch of those nerves were damaged, but you don't actually have a severance of a solid cord. So they could walk around. They didn't feel quite great. They definitely need this L2 thing to be fixed, but they're not actually paralyzed. And again, just because we're here and we can, what else do we see in this picture? We can see the sacrum and coccyx look awesome. Look at that. And you can really see the 5 bone situation. You can see coccyx there pointing pretty far inwards. This is going to help tell you that this person is male. You can see the sacral crest and the continuation of the vertebral canal into the sacral canal, pubic bone. We're in a midline sort of a orientation, so this is the midline part of the pelvis, right? Is the pubic bone. We can see a lot of intestine situation going on in here. What do you think this is? That's their stomach. This is an empty stomach. Pretty cool. And yes, I know I've said pretty cool on like practically every single slide, but it is actually pretty cool. It's amazing that you can see any of this stuff without surgery and infer even really tiny, tiny details out of this. So what type of imaging is this? This is CT, and then what do we see? What is weird about this one? We still have bodies of our vertebra, pretty visible. These all are showing up, our spinous processes. We have, again, a very, very nice sacrum. Look at these. Does this vertebra look as nice and tidy as that vertebra? No. What this is referred to is a sclerotic and moth-eaten appearance, and this is indicative of lymphoma of the spine, primarily of L5, although you can see quite a bit of encroachment on L4 as well. All right, so this is the last one, and this one is tricky. So think about this for a minute. You're not just going to be looking at bone, you're going to be looking at other stuff too. What type of imaging is it? This is T2 imaging. Fat's nowhere to be seen. What else do you see? We can see the bodies of our vertebrae perfectly well. Transverse processes look okay. We can see axis with the dens quite clearly. We can see some musculature. We can see where the lungs are. Now, this isn't a spinal injury, but it is spinal adjacent. So, and I just sort of wanted to use this as an example too of the kinds of things that you can see with this. This is showing a brachial plexus injury. This is an avulsion of the brachial plexus that was popped off with a pseudomeningocele. So this is going to have fluid buildup, and it's going to show up black. So where do we find our brachial plexus? Well, those are going to be coming out. Those nerves are going to be coming out from mostly the cervical spine, right? So those are, you can actually see through here, those roots. Over here, you see a little of that, but you mostly see this big open black space, right? This is a meningocele or a pseudomeningocele. This is going to be a buildup of fluid around these nerves surrounding the injury.